Today we're talking about hands. It's something that we often take for granted, but most of us use our hands daily for everything that we do. And it's important that we take good care of them. So we're going to find out a little bit more about how to take good care of our hands today and some common ailments, including carpal tunnel, trigger finger, and arthritis, and maybe even one that you've not heard of. We're at Divine Savior Healthcare, and we've got a great team to talk to today, including Carissa Yura, certified hand therapist, and Dr. Frank Walter, orthopedic surgeon. From Divine Savior Healthcare here in Portage, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Divine Savior Healthcare, and we're talking about taking care of one's hands. This is something that's really important because obviously most of us use our hands in almost all of our day-to-day tasks. And I'm joined now by a great panel of experts. This is Carissa Yura and Dr. Frank Walter. Thank you for joining us today.
Yeah, thanks for having us.
So we're going to kind of tackle a couple of different ailments that often happen to people's hands. We're going to start out with one that I think most of us have heard of, carpal tunnel syndrome. Most of us are at least familiar with this term, but what exactly is it?
Carpal tunnel syndrome is a collection of what we call signs and symptoms that lead to a feeling of numbness and tingling in the hand, specifically in these fingers, really, for the most part.
Okay.
And it can actually be accompanied sometimes by pain, but pain's not the primary thing. People will complain of numbness and tingling and a discomfort right along the middle of their arm, right? In a nerve called the median nerve, right down the middle.
Okay.
So that's kind of why it makes sense. It often bothers them at nighttime where they wake up and you roll over and your spouse is shaking their hand like this.
Yeah.
They've got carpal tunnel. There's no question about it.
Interesting. So that's so different from what I thought it was, because I thought that the pain, from writing or doing the mouse or doing the keyboard was what the main symptom, but you're saying it's more the tingling and the numbness.
It's a combination of both, but the numbness and tingling is usually the predominant thing. I like to tell people sometimes the numbness can be so deep and the tingling so severe that it feels painful.
Wow, it's incredible. So what are some early warning signs or symptoms of carpal tunnel? I mean, is that, if you first notice tingling, I mean, can you jump to the conclusion that you have carpal tunnel, or are there other warning signs?
For the most part, yeah. I mean, if you're typing all day, if you're working out in the yard all day, or even sewing, knitting, activities like that, and all of a sudden you feel like you have to shake your hand to kind of wake it up like it's fallen asleep.
Really?
That's probably the earliest, most simple warning sign.
No kidding.
People notice it driving a lot. They notice it talking on the phone a lot.
I was going to say that's when I get it. When I'm
on
on the phone for a while, my hand starts to go a little bit numb. And
anything that causes you to have to squeeze your hand and hold it in a grasping position for a long period of time can cause that feeling of numbness and tingling, or even changes in temperature where it's really hot or really cold.
Wow.
Yeah.
Carissa, you are a certified hand therapist here on the panel. First time on Wisconsin Doctors, so welcome. If someone is diagnosed with carpal tunnel syndrome, what are some things that they can do to treat it from a conservative or non-surgical standpoint?
Yeah, so catching carpal tunnel early and treating it conservatively can be very successful. And so if you're referred to therapy for conservative treatment, one of the first things we would do is splint the wrist, putting you kind of in a neutral position.
Sure.
With activity, or especially at night, can minimize symptoms. We might try some massage, and trying some gentle stretching can be very effective as well. So can I show you a couple of those stretches? So the first one might be just stretching into a gentle wrist extension, and so holding the wrist and the fingers back like this for about 30 seconds, and trying that several times a day. Another one would be tendon glides, and so with this, we're just gently moving the fingers into different positions. Instead of shaking them out, we're just moving them into different positions. So the first one would be just kind of a hook position, and then a gentle fist position, and then what we call a flat fist position, and then a table tap position. So again, it's a hook, a fist, a flat, and a table tap. And you would do 10 repetitions of that several times a day. And then this is the big one that Dr. Walter likes, which we call, at this point, we're calling it the showman. And so this is a median nerve glide. And with this, you're going to gently bring the arm and the wrist and the fingers back, kind of in and out, like so. And that's just gently gliding that nerve to bring nutrients to the nerve and calm it down a little bit. And so you would do that 10 times, again, several times a day. If you're starting to get the symptoms with activity, that's a good time to take a break and try those stretches.
And try some of those stretches, yeah. We just have a couple seconds left, but I'm wondering, Dr. Walter, is this something that eventually would need surgery if it was untreated, or the conservative treatment?
People have carpal tunnel symptoms and they live long enough, they'll want to have surgery to make it go away.
Okay.
When the symptoms start coming on 3, 4, 5, 6, 7 times a week, right, it's time to get it fixed, because it's not going to go away on its own. Completely. You can mitigate it, make it smaller with the exercises Chris had talked about, and make it more tolerable. But eventually, if you want it to go away, a simple procedure can really take care of it. I'm a victim myself.
Okay.
It worked really well.
All right.
Yeah.
Good to know. We got to take a short break. When we come back, we're going to talk about trigger finger. Don't go away. We've been talking about carpal tunnel syndrome, at least in the last segment. What we're really talking about is care of your hands. And we're talking about something now that is, I guess, similar to carpal tunnel, trigger finger. Now, this is something that might mean different things to different people, but from a medical standpoint, can you clarify what is it and what are the common causes?
Yeah, a trigger finger is, again, a very common condition that a lot of us will develop in time, whether we're a heavy laborer or just a mom who works around the house all day taking care of everything there is to take care of. Most often characterized by pain in the palm.
Okay.
Right on here, right on the palm pads here.
Okay.
And the pain can be there with or without movement, but when you start to move your fingers, as the tendon or the rope that moves our fingers glides through this tight tunnel, it can become thick and swollen. And that causes pain. In the worst cases, the finger can actually click or almost jump.
Okay.
When it comes through there. And in the very worst cases, the patient might wake up in the morning with their finger locked in this position and have to kind of pop it loose. Yeah. That's a trigger finger.
Okay.
You know, if you've got that, you know what the diagnosis is.
So I've had that before, where if I'm, working in the kitchen, I'm doing a lot of cutting, and I'm using, this finger as pressure on the knife. I've had it happen where this finger gets locked in place. That's trigger finger.
That's a trigger finger.
Wow.
And in your case, it sounds like it's not that painful, right? Not all trigger fingers are painful. When they're painful, we start talking about other things to do.
Yeah. I just assumed it was a muscle spasm, but that can be considered trigger finger.
Probably.
So are there any early warning signs of this? I mean, we talked a little bit about some of the warning signs of carpal tunnel syndrome. Are there any different warning signs for trigger finger?
Trigger finger is mostly pain. Okay. Again, pain in this area along here, along with that catching sensation or even that locking sensation.
Sure. Okay. And from a treatment standpoint, I guess, is there something, Carissa, that people can do to treat it from a conservative standpoint? Stretches or anything like that?
Yeah. So trigger finger caught early in the pain or clicking stage is more successfully treated than somebody who maybe is having to unlock their finger. But if it's caught early, we can certainly splint that finger so that they're not coming into a full bent position of that finger with activity, which minimizes the tension and the inflammation on that tendon. And also talking about maybe different tools to use in the kitchen, maybe a wider handle on the device that you're using or the tool that you're using to minimize stress on that tendon. Also massage and doing a little bit of tendon stretching during the day can be helpful as well.
I think they tell you that when you're cutting, putting your index finger on the knife is not good technique, that you want to actually grip the handle like it was meant for. So that's probably some good advice too. Is this something that can be or needs to be fixed with surgery? I mean, similarly
not necessarily.
to carpal tunnel?
I recommend to most of my patients, as Carissa suggested in the very early stages, to try anti-inflammatories if it's safe for you, a Motrin or a Tylenol, for about a month before you can institute treatment. Again, as long as it's in those early stages. If If it's locking down and painful every day,
Right.
it's too far gone.
Sure.
And then you might need to come see a surgeon like me to talk about maybe a cortisone injection or even potentially a minor procedure to take care of it.
Sure. We just have about a minute left in this segment, but between segments, we were kind of talking about trigger finger, carpal tunnel, and specifically with carpal tunnel, this is something that you said that if we live long enough, we're all going to get it to some degree. And it's not necessarily what people think it is, like the typing on the keyboard and stuff like that that causes it, but it's just something that everybody eventually gets.
Sure. I mean, I think the common misconception is that all this use with keyboards has created a dramatic increase
epidemic
in the amount of carpal tunnel. And I don't think that's necessarily true. Certainly in certain indications, certain places, keyboarding for a long period of day, especially using the mouse, we found can lead to increased symptoms of carpal tunnel. But it's true, most of us in our lifetime will experience some episode of carpal tunnel, whether it's numbness and tingling for once a day every 3 or 4 weeks, or whether it's every day, you know, 4 or 5, 6 times a day. And it's when it gets to that everyday period that we like to think treatment is more appropriate, so that the damage that's done to your nerve doesn't become permanent.
Yeah,
and that's what's scary.
Absolutely. We're going to take a short break. When we come back, I'm going to try to pronounce an ailment that I've never heard of, so you'll want to stick around to see how successful I am. We'll be right back with more Wisconsin Doctors. We're back here at Divine Savior, and we've been talking about how to care for your hands. We've talked about a couple different ailments, both of which I had no problem pronouncing, but we're going to try this one. This is one that I've not heard of. Dupuytren's contractures. How'd I do?
Very good.
All right. So, you know, obviously, most of our viewers have heard of the first two, which was trigger finger and carpal tunnel syndrome. Let's talk a little bit about Dupuytren's contractures. What exactly is it?
Dupuytren's contracture is probably more common than people realize. Okay. And it's something that's characterized by really a disease process in the skin that's genetic. So you can blame your mom for this one too.
Oh, great. Okay.
Right. And what happens over time is people develop these thick cords in their palm, usually, and eventually the finger starts to draw down to where they might get stuck, where they can't straighten that finger out at all because of the thick cord that's in the palm.
Different from trigger finger, because you can usually stretch that back out.
Yeah, so trigger finger can pop right out. And Dupuytren's is almost never painful.
Okay.
It's just more annoying because you go to put your hand in a glove and you're stuck.
Yeah.
You know, you'll put your hand in your pocket and you can't get there.
Yeah.
And in the worst case scenarios, when it curls all the way down, it's hard to even clean in these spaces in here. It becomes a hygiene issue.
Wow.
So we like to catch it before it gets that far.
Before it gets permanent that way. Wow, that's incredible. So what are some of the early warning signs? I mean, is it you wake up one morning and then your finger's like that?
It's a very slow, steady process that takes years and years to develop to get to that point. You might just start by feeling a little thickness in your palm, right? And it's like, that's kind of weird, but it doesn't hurt. And then eventually you start to realize that when you go to put your hand flat on the table, you can't quite get that one finger flat.
Right.
Right? And that's usually a sign that something is going on in here.
Okay, and is it always the ring finger?
It's most commonly the ring, the small, and then it moves on to the index and the long, and the thumb is involved as well, but very rarely.
So it can spread?
It can go anywhere.
Wow, okay. And you mentioned it was like a skin disorder? It's not something with the tendons or something? It
has nothing to do with the tendons.
Wow,
yeah.
Okay.
It feels like it, but it's not.
Interesting, interesting. So if someone is diagnosed with Dupuytren's contractures, what are some things that they can do to treat it from a more conservative standpoint?
Yeah, so unlike carpal tunnel and trigger finger, Dupuytren's is a little less successful in conservative treatment. But if it's caught early on, possibly wearing a night splint that would hold that finger in extension might kind of prolong that time before you need surgery. And again, just trying to kind of stretch it periodically throughout the day, kind of stretching it into extension. Like Dr. Walter said, usually the most common fingers are the ring and the small. Although annoying to put in pockets and gloves, we can still function with the other fingers if these are involved. You know, these two are involved. So that's a little less detrimental, and it can kind of prolong that surgery date.
And so it kind of sounds like this is something, you know, similar to carpal tunnel, that if we have the genetic, I mean, everybody's going to get carpal tunnel, but if we have the gene, that this is just going to happen.
Yeah, interestingly enough, I don't think that's true. I think there's people who have the gene where the gene never really gets turned on in life.
Oh, wow, okay.
It can get turned on by things like trauma, bend it really fast, break a finger. Trigger finger can actually turn into Dupuytren's if you've got the gene.
Oh,
so
okay.
there's some interesting things. Chris's point is well taken that people can live with minor contractures because they get by, especially because these fingers are not involved.
Right.
Right. It's when they start to curl all the way down that we need to see them sooner than later so that we can get them back straight again.
Right.
Yeah.
And so what is that process like? I mean, is it a pretty major surgical procedure? Is it minor?
It can be, but if we catch it early enough, there's a lot of things I can do even in the office where it doesn't even involve surgery at all. They can take a bent finger and straighten it out that day.
Wow.
Yeah, so it's something that if you've got it, I would encourage you to come in and see us so that we can assess you and see if we can make you better.
Absolutely.
Yeah.
Well, we're going to take another break. When we come back, we're going to talk about another thing that might be inevitable, arthritis. So don't go away. We're at more Wisconsin Doctors here at Divine Savior. Back here at Divine Savior Healthcare in Portage, talking about how to care for our hands in today's episode of Wisconsin Doctors. And we're now to our grand finale, as it were. We're talking about arthritis. Now, again, this is something that it's pretty likely that most of us are going to get at some point if we live long enough. So we know it's pretty common. It can be very painful, but how do we actually define it? I mean, if I have pain in my hands, can we assume that that's arthritis?
I don't think necessarily.
Right.
Whereas arthritis in knees and hips is very common as we age because we're walking on those all of our life. Arthritis in our hands, although prevalent, is not as common as those other areas.
Okay.
And not all pain in the hands is from arthritis. It's
Right.
from other things like trigger fingers and carpal tunnels and things that we've talked about earlier before.
Yeah, okay. So that's good to know. So that if you have pain in your hands, it's not necessarily because of arthritis. It could be something else.
Sure.
Something worth talking to your primary care provider about. What are some of the early warning signs about arthritis in the hands?
People who have arthritis in the hands will typically notice swelling in their knuckles.
Okay.
They'll notice they wake up in the morning, the hands are very stiff and it takes them a while to get them moving. The pain that they have from pinching and grabbing might cause weakness. Okay, and things along those lines. But it's really just the swelling and the lack of motion. When you say people go to make a fist and they can only get this far down, it's probably some variation of arthritis along the way.
Right. Carissa, our certified hand therapist, this is kind of your moment to shine here because you can help folks out more from a conservative standpoint who do have arthritis of the hands. Can you talk to us about what some of the things that you can do to help?
Absolutely. So when we're referring to arthritis in the hands, one of the big things that we talk to patients about is how to modify activity so they're not placing that repetitive stress on the hands. So if they have a job where they're working a repetitive gripping type of activity, or they like to bake and they're in the kitchen a lot using their hands, again, how do we use different tools or different methods to take some of the stress off of those arthritic joints and those painful hands? If you're doing an activity repetitively and it's painful, take a break from that activity. So a big part of therapy is just delving in with the patient about what they do day to day so that we can help modify some of the things that they do. Two of the big things we talk about is if you're carrying a grocery bag and you have a painful arthritic hand, don't carry it like this, but place it on the forearm, place it on a larger joint and use the larger joint rather than the smaller joints of the hands. Or if you're opening a jar in the kitchen, don't use that constant twisting motion. Use a larger jar opener tool to decrease the tension on the hand.
Or your teeth. No, I'm just kidding.
Splinting can be very successful in this aspect. So if you have a certain joint of the hand that's painful, such as the thumb, we would place a splint on the hand to protect that thumb. And you might find yourself wearing it during activity, or again, just kind of resting that hand at night. Gentle exercise is important with arthritis. So not full-on gripping, but those gentle tendon glides that we talked about earlier to gently move the joints and bring nutrients and blood flow to the joints. And another thing that can be really successful in the case of arthritic hands would be arthritic gloves. And so that's just a really gentle compression glove that you would wear, again, day and or night to provide a little bit of pressure and support to those hands and decrease some of the pain that you're having.
And when you talk about joint protection, because that was a phrase that was mentioned earlier, I think between segments, is that where you're just avoiding using some of those joints? Like when you talked about opening the big pickle jar, you're avoiding using those joints. Is that what you would consider joint protection, or is it sort of all of the above?
Yeah, so avoiding using the joints, or if that's not possible, which, if somebody really loves baking or they really love knitting, that's not a possibility. And so using them in a different way, being smart about how we use our joints.
Sure, gotcha. Dr. Walter, we talk about, you hear people who have arthritis of the hips, arthritis of the shoulder, whatever, and they have, or knees, and they have, full knee replacements, full hip replacements. But obviously, we kind of joked before the segment started that it's hard to do a full hand replacement. So is there any surgical option for people who have arthritis of the hands?
I think, yeah, there is. Specifically when it comes to the thumb. The thumb has a great history of success with treating arthritis. In a way that's a little different than the knees and hips, but it can work just as well. Unfortunately, replacing the finger joints, the small joints, we haven't quite figured that challenge out yet, but we're working on it every day. So for now, we kind of avoid that for the most part, but we really focus on the thumb, which fortunately is the most common place for people to get it.
Right.
So there's an opportunity there. If it's hurting you really bad, come see a hand specialist, and I think you'll have better results.
If someone suspects that they may have, any of these things that we've talked about today, carpal tunnel, trigger finger, arthritis, Dupuytren's, where's a good place to start? Should they start with their primary care provider? Can they go right to you, Carissa, for some help? I mean, obviously you've got some certification to help people. Where do they start?
I think in order to get to Carissa, they would need a referral from either their primary care doctor or from a hand surgeon like myself. But for all these conditions, whether they're in the early stages or the later stages, I'm happy to see those people. And I think it's appropriate to even start right at our office.
Awesome. Well, Dr. Frank Walter and Carissa Yora, thank you so much for joining us today. Thanks for the information.
Thanks so much.
And thank you to all of our viewers. From all of us here at Divine Savior Healthcare and Wisconsin's 57, we invite you to live longer, live better. We'll see you next time.